Welcome to today's episode of the Be Sure podcast. Living with epilepsy involves challenges beyond seizures, including stigma and emotional impact. However, with the right treatment and adjustments, many people with epilepsy can lead active lives. To help us better understand this, we are fortunate to have a renowned consultant neurologist with extensive experience in treating epilepsy. Welcome, Doctor.
Yeah, myself, Dr. Pankaj Popli. I am a basically DM neurologist from SGPGI Lucknow, and currently I am practicing in Gomti Nagar, Lucknow.
Let's start with the basics. What exactly is a seizure and how does it affect the brain?
First of all, hello everyone. It's really nice to be part of this podcast for knowledge sharing on this very important topic of epilepsy. Basically, what is epilepsy? Epilepsy basically the brain uses tiny electrical signals to control everything we think, what we feel, what we do. A seizure happens when there is an abnormal electrical activity in the brain. Some doctors also describe seizure as a form of storm in the brain. During a seizure, person might lose consciousness. There is abnormal jerky movements of the limbs or body. They become confused, or even there is a feel that there is sudden change in the behavior of the patient.
What are the different types of seizures and do they affect people differently?
Yes, there are different types of seizures. They depend on where the unusual activity starts in the brain and how much brain is involved. We usually classify seizures as either having a generalized seizure or a focal seizure. Generalized seizure involves the entire brain, and patient is there is loss of consciousness. And while focal seizure start in one particular area of brain, and patient usually do not lose consciousness.
I see. Now, can you explain what causes epilepsy? Is there always a known cause?
No, not always. About 50% of adults with epilepsy, we may not find a specific cause. But for in other half of 50, in which we find a cause, common causes include past history of any head injury, brain infection like a neurocystic cirrhosis or a tuberculoma, which is very commonly seen in our country, Indian scenario. Sometimes there is also we find tumors in the brain, and in people more than 65 years of age, stroke is also a very important cause of epilepsy. Genetics sometimes play a role, especially if we are not able to find any other cause of epilepsy. Among genetic epilepsy, juvenile myoclonic epilepsy, and childhood absence seizure are some of the common causes.
Well, that's really helpful to understand. Well, what are some of the signs or symptoms of epilepsy that caregivers should look out for?
Yeah, this is again a very important question. Symptoms can vary a lot, but some common signs of seizure include, I have already told you, sudden convulsion or jerky movement of the limbs, loss of consciousness, sudden onset of staring look, confusion, or even sudden fear or strange feeling, sudden onset of confused behavior. Some people may shake in just one part of the body, as I have mentioned in a focal onset seizure, like a arm or leg. If someone have these symptoms more than once, it is always advisable to consult a neurophysician.
Now, let's talk about something that many people with epilepsy face: stigma. Can you tell us why epilepsy is often misunderstood?
Yes, unfortunately, epilepsy has been misunderstood for quite a long time. Historically, people didn't realize that epilepsy is a neurological condition. They thought it is to be a somewhat supernatural things, and myth develop around it. Seizure can look frightening, so people may react differently with fear, even avoiding these things, and which lead to lot of social stigmas.
How does this stigma affect people with epilepsy?
Various medical researches actually have shown that the stigma can increase the frequency of seizure because stress is a common trigger for epilepsy. Stigma can have significant impact on people with epilepsy. It affects their quality of life, psychological health, leading to depression, anxiety, even suicidal thoughts and suicidal ideation. They may also experience discrimination in their workplaces. in children, they can also discriminate, they feel discriminated at school, and they are reluctant. People with epilepsy are reluctant to get married. So getting married and having kids is also a big task for these epilepsy patients.
Absolutely. Now let's move on to managing epilepsy. What are the common triggers for seizures that patients and caregivers should be aware of?
Yeah, this is there are basically two points in this question. First point is managing epilepsy, and second point is the triggers. As a
Yes, sir.
neurophysician, our first aim is to diagnose the type of seizure, as told you, generalized or a focal onset seizure, and ideally we should classify into a epilepsy syndrome. If we are able to classify in a particular epilepsy syndrome, then we can specify the treatment. The mainstay of treatment of epilepsy is basically anti-seizure drug based on the type of seizure. And coming to the second part, that is triggers, they are vary from person to person, but common triggers of epilepsy include, most common is missing the dose of seizure medicine, lack of sleep, high stress level, skipping meals and certain food like consumption of alcohol can precipitate seizure, flashes of the lights, bright light, fever on any sort of any systemic illnesses. In women, especially hormonal changes during the menstrual cycle can also precipitate seizure. Managing a seizure diary is very helpful to possibly track the seizure, and it is very helpful in managing these triggers. Thank you.
Thank you so much, Doctor. To wrap up, could you share some safety tips to help prevent injuries during seizures?
Of course, injuries are very common. If patient is having convulsion, they can fall, and they can, there is a chances of head injury, or they can there is also a chance of shoulder dislocation. So first and foremost thing is, first keep yourself and other people calm. Remove anything near the patient that can cause injury, like a sharp object, knife, or any glass items. Place the patient in either a lateral position, side lateral position, to prevent choking in the throat. Never ever try to put anything in the mouth. This is very important, because sometimes what happens, when you see a patient having seizuring, there is clenching of the teeth. So any caregiver or nearby can try to put spoon or anything in the mouth. Never try to put
Yeah,
anything
yes, sir.
in the mouth, because that can break your teeth, and that can cause choking. And even don't try to put water in the mouth also. Loosen any tight clothing around the head and neck, because it can cause suffocation. Watch for any signs of breathing problem, like bluish discoloration of the skin or face.
Thank you so much, Doctor. This has been incredibly informative and helpful. We hope today's discussion helps listeners better understand epilepsy and how to support themselves or their loved ones, of course. Any final thoughts?
Yes, just remember, with right treatment and proper guidance, many people with epilepsy can manage their condition very well and lead a full active life. Regular compliance to the medicines, being aware of the triggers, practicing healthy lifestyle, having support makes a very big difference. And always remember, you are not alone. There is lot of support in the form of family, friends, and your doctor. And you should always consider your doctor as your best friend, who is there to help you every time. And last but not the least, always feel free to ask question with your doctor. Know your disease and believe in yourself. Thank you.
Thank you, Doctor. And thank you to our listeners. Until next time, take care and stay informed.